Autobiography of the respiratory drug, the Loratadine.
Hiya and welcome everyone. For today, you're about to learn so many things about me, Loratadine. You will get to know my drug name, drug classification, pregnancy category, mechanism of action, pharmacokinetics, indications and contraindications, side and adverse effects, and last but not the least, your nursing responsibilities. So, tune in.
But before we tackle the contents, let us define Loratadine. Loratadine is an antihistamine medicine that relieves the symptoms of allergies. It is also used for reactions to insect bites and stings, and for some food allergies. Loratadine is known as a non-drowsy antihistamine, meaning it's much likely less to make you feel sleepy than some other antihistamines.
Aside from calling me Loratadine, you can also call me through my other names, my brand names, Alerta and Claritin.
Chemical name: ethyl 4,8-chloro-5,6-dihydro-11H-benzo 5,6-cyclohepta 1,2-B pyridine 11-ilidine 1,piperidine carboxylate.
In the therapeutic drug classifications, I am classified as an antihistaminic.
And in pharmacologic classification, I am tricyclic antihistamine.
The Food and Drug Administration, or the FDA, put me under the pregnancy risk category B.
Mechanism of action: Loratadine blocks one type of histamine receptor, the H1 receptor, and thus prevents activation of cells with H1 receptors by histamine. Unlike some antihistamines, Loratadine does not enter the brain from the blood and therefore does not cause drowsiness when taken at recommended doses. Loratadine binds to H1 histamine receptors found on the surface of epithelial cells, endothelial cells, eosinophils, neutrophils, airway cells, and vascular smooth muscle cells, among others. H1 histamine receptors fall under the wider umbrella of G-protein coupled receptors and exist in a state of equilibrium between the active and inactive forms. Histamine binding to the H1 receptor facilitates cross-linking between transmembrane domains 3 and 5, stabilizing the active form of the receptor. On the other hand, antihistamines bind to a different site on the H1 receptor, favoring the inactive form. Hence, Loratadine can more accurately be classified as an inverse agonist as opposed to a histamine antagonist, and can prevent or reduce the severity of histamine-mediated symptoms.
Do you want to know how the body reacts to me? Well then, let us go to my pharmacokinetics. For my absorption, I am rapidly absorbed and I achieve peak plasma concentration within 1 to 2 hours, while my main metabolite achieves peak plasma concentration in 3 to 4 hours. Liter per kilogram of myself is distributed, and I am 97 to 99% bounded to plasma proteins. I undergo hepatic metabolism through first-pass extensive metabolism to an active metabolite, primarily by cytochrome P450 3A4 and to a lesser extent by cytochrome P-450 2D6. Over a 10-day period, I am 40% excreted in the urine and 42% eliminated in the feces.
My indications is to manage symptoms of allergic rhinitis, wheal formation, urticaria, and other allergic dermatologic conditions.
I am contraindicated in patients who are hypersensitive to my treatment, and you should use me cautiously in patients with hepatic impairment and in breastfeeding women.
Side and adverse effects. Loratadine may cause side effects. If this happens, tell your doctor if any of these symptoms are severe or do not go away, such as headache, dry mouth, nosebleed, sore throat, mouth sores, difficulty falling asleep or staying asleep, nervousness, weakness, stomach pain, diarrhea, red or itchy eyes. Some side effects may be serious. If you experience any of the following symptoms, stop taking Loratadine and call your doctor immediately, such as rash, hives, itching, swelling of the eyes, face, lips, tongue, throat, hands, arms, feet, ankles, or lower legs, hoarseness, difficulty breathing or swallowing, and wheezing.
For your nursing assessment, assess the patient for any history of allergy to any antihistamines, narrow-angle glaucoma, stenosing peptic ulcer, symptomatic prostatic hypertrophy, asthma, bladder neck obstruction, pyloroduodenal obstruction, lactation, and pregnancy. Should also assess the patient's skin color, lesions, texture, orientation, reflexes, affect, vision examination, adventitious sounds, prostate palpation, and serum transaminase levels. You should also perform a physical examination to establish baseline data for assessing my effectiveness and the occurrence of any adverse effects associated with my therapy. You should administer me on an empty stomach, 1 hour before or 2 hours after meals to increase the absorption. Provide patient relief from dry mouth. Increase the patient's fluid intake to decrease the problems of thickened secretions and dry nasal mucosa. Ensure patient's voiding before each dose to decrease urinary retention if this is the problem. Caution the patient to avoid alcohol while taking me because serious sedation can occur. Also, provide thorough patient teaching including my name and prescribed dosage measure to help avoid adverse effects, warning signs that may indicate problems, and the need for periodic monitoring and evaluation to enhance patient knowledge about my therapy and promote compliance. Monitor patients' response to me. Also monitor for adverse effects such as skin dryness, GI upset, sedation and drowsiness, urinary retention, thickened secretions, and glaucoma. Monitor the effectiveness of comfort and safety measures and compliance with my therapy.